Hello everyone. So once again, welcome to you all to our pediatrics university question answer discussion. So in this video, we are going to discuss about the protein energy malnutrition. So different kind of questions which are usually asked in our university exams from the nutrition chapter. It may be asked as essays, short essays and short notes. And one of the essay question is that is a 2-year-old male child with the weight 5 kilogram and height is 75 centimeter and mid upper circumference of 10 centimeter presenting with bilateral pedal edema. What is your probable diagnosis and what complication you expect in this child? How will you manage the child? So this is a question, essay question. So uh, in this, we can find out the diagnosis that the clinical condition satisfies the criteria for the severe acute malnutrition. That is, this child have the 2-year-old child. So usually the severe acute malnutrition which occurs at the age of 6 months to 6 years of age. So it is a 2-year-old child. Therefore, one of the criteria is this. Then wait for the height less than 3 standard deviation. So if we plot a graph with the weight and height, if we get a graph of or the if we get the plotted graph is that is weight for height is less than 3 standard deviation, it is also satisfy the criteria for the severe acute malnutrition. One of the major criteria is the mid upper arm circumference of 10 centimeter. That is usually the mid upper arm circumference less than 11.5 centimeter is a essential criteria for the severe acute malnutrition, and also bilateral pedal edema, that is also an indicator of the criteria for the severe acute malnutrition. So the diagnosis is severe acute malnutrition. And another short essays are describes pathogenesis, clinical features, grading and complications, and management of kwashiorkor. Then also they mention the classical features of marasmus, grading and outline the nutritional management in a child with marasmus. Then next question is about um, the discuss etiological causes of the protein energy malnutrition. Then what is severe acute malnutrition, then Bangle test, then what are the age independent criteria for the diagnosis of malnutrition, and classification of protein energy malnutrition. These are the usual questions which are usually asked. And the one word answer is like, what are the 4 cardinal signs of kwashiorkor? So these are the usually asked questions in our university exam. So we have to learn the details about the protein energy malnutrition. So we usually in the severe acute malnutrition is defined based on age independent criteria. That is, we uses these age independent criteria like mid upper arm circumferences. That is, it remains constant between 1 and 5 years of age and can be used to define the severe acute malnutrition. So one of the age independent criteria is mid upper arm circumference. Another is Bangle test. A bangle with 4 centimeter internal diameter is slipped up the forearm. If it crosses the elbow, the child is malnourished. So the Bangle test is used as an age-independent criteria for the severe acute malnutrition. And then we have the Sharkey's tape. That is, it is a plastic tape with red, yellow, and green zones showing mid upper arm circumference less than 12.5, 12.5 to 13.5, and more than 13.5 respectively. If it is less than 12.5 or 11.5, it is an indicator of the severe acute malnutrition. Then we have the quack stick, that is measures mid upper arm circumference for the corresponding height. Then we have the Canavati index, that is mid upper arm circumference to head circumference ratio. Then we have Rao index, that is weight by height square into 100. If the value of this is less than 0.25, that is indicative of the malnutrition. Then we have the Pondral index, that is weight by height raised to height cube, that is for differentiation between the symmetrical and asymmetrical IUGR. Then we have the Dugdale's index, that is weight by height raised to 1.6. If this value is less than 0.79, which suggests malnutrition. And then we have the body mass index, weight in kilogram divided by height in meter square, which can show the wasting as well as the obesity. So these are the age independent criteria which are used for the diagnosis of the severe acute malnutrition. For in this, the mid upper arm circumference and the Bangle test are which are the most important. Then another question is regarding the set score. So what is the definition of set score? The set score, it is equal to measured individual value minus reference median divided by the standard deviation of the reference median. This is the equation which showing the set score. It is usually asked as a 1 mark question. What is a set score? So the set score is equal to the measured individual value minus reference median divided by the standard deviation of the reference median. This is the uh, equation of the set score. Then we moving on to the major topic, that is undernutrition. In that, define and classify undernutrition or the protein energy malnutrition of the children. Describe the clinical features, management, and salient points of difference between kwashiorkor and marasmus. Define severe acute malnutrition. Describe the 10 steps in the management of severe acute malnutrition. And short note on the appetite test and ready-made uh, ready to utilize therapeutic food. So these are the short notes and short essays which are usually asked in a university exam. Then about the definition of the protein energy malnutrition, it is a set of conditions arising due to the inadequate intake, poor utilization or excessive loss of nutrients as in the diarrhea. Like as in case of diarrhea cases. So it is a set of conditions arising due to the inadequate intake, poor utilization or excessive loss of the nutrients. The malnutrition, which ideally refers to both undernutrition and overnutrition. However, practically both the protein energy malnutrition and malnutrition, which are used interchangeably with the undernutrition. Then what are the hazards due to the undernutrition? There will be, because of the undernutrition, there will be high risk of the infections and mortality in the children. And important, it is an important contributor to under 5 mortality. That is 35% of the under 5 mortality is due to the protein energy malnutrition. And if the shorter adult height, less cooling and reduced productivity will be results as a result of the undernutrition. So these are the hazards due to undernutrition. That is increased morbidity and mortality and infections, important contributor of under 5 mortality, and the less cooling and reduced productivity will be there. Then about the etiology, there is also a short notes. That is what are the etiology or what are the causes for the protein energy malnutrition. The key determinants for the undernutrition are low birth weight, infections like the low birth weight is one of the major criteria for the causation of the undernutrition. Then we have the infections like diarrhea. In this, we have the loss of nutrients and pneumonia and measles, and low food intake. That is inadequate breastfeeding or the complementary feeding also contributes to protein energy malnutrition. Therefore, low birth weight, infections like diarrhea, pneumonia, and measles, low food intake, that is in the case of inadequate breastfeeding or the complementary feeding, which are all results in the undernutrition. And other factors like cultural practices and food fats, then socioeconomic factors like poverty, inadequate availability of the food, that is food production and poverty, availability and utilization of the healthcare services, that is clean water, sanitation, healthcare availability, which are all the other factors which results in the undernutrition. Then about the pathophysiology, there's many theories which have been proposed to explain the spectrum of the clinical manifestation in the protein energy malnutrition. One of the theories is Gopalan's theory of adaptation and disadaptation. The malnourished child which tries to adapt to protein and calorie lack by reducing their body metabolic rate, basal metabolic rate, and by the altering the balance between the catabolic hormones, that is cortisol hormone and anabolic hormones like insulin. When this adaptation fails, the muscle and fat breakdown starts with the fatty liver and edema. So this is the pathogenesis of edema in the case of severe acute malnutrition, that is severe protein energy malnutrition results in the hyperalbuminemia. Because of the lack of protein, there will be hyperalbuminemia, and this causes the decreased glomerular filtration rate and decreased BP, and that activates this decreased GFR and the decreased BP, which activates the renin-angiotensin aldosterone activity, and that in turn causes the increased sodium and water retention that results in the edema. So this is the pathogenesis of the edema in the case of protein energy malnutrition. Then about the classification of undernutrition, we have classification according to weight for age. That is WHO classifications for community studies are the classification. Underweight is classified as low weight for age. That is weight for age is less than -2 standard deviation. And the stunting is defined as low height or length for age. That is height or length for age is less than -2 standard deviation is called as stunting. And wasting is low weight for height. That is weight for height is less than -2 standard deviation is called as wasting. And the stunting and wasting, low weight for age and low height for age is called as stunting and wasting. That is weight for age is less than -2 standard deviation and height for age is less than -2 standard deviation. So these are the WHO classification for the community studies. Then we have the IAP classification for the protein energy malnutrition, and the K suffixed if edema present, the K is suffixed. Then this is the percentage of expected weight for age, and this is the classification of the protein energy malnutrition. If the percentage of expected weight for age is greater than 80%, it is normal, and the expected weight for age is greater 71 to 80%, it is grade 1 protein energy malnutrition. If the percentage is 61 to 70%, it is grade 2, and 51 to 60%, it is grade 3, and less than 50%, it is grade 4. Then we have the GOMS classification, that is weight for age, percentage of expected greater than 90, the nutritional status is normal, and 75 to 90 first degree protein energy malnutrition, 60 to 75 second degree protein energy malnutrition, the less than 60 we have third degree protein energy malnutrition. And based on the height for age, we have the Waterloo classification, Maclaurin's classification, and Rao's classification. And based on the weight for height, we have the Waterloo and Maclaurin's classification. And this is the WHO classification. That is, the weight for age is normal, height for age is normal, the weight for height is normal, it is interpretation is as normal. And if the decreased weight for age and decreased weight for height, but the height for age is normal, it is called as acute malnutrition. In the chronic malnutrition, the height is affected. So the weight for age or height for age, or it is decreased, but weight for height is normal in the case of chronic malnutrition. But everything is decreased. That is weight for age, height for age, and weight for height is decreased in the case of the acute and chronic malnutrition. Then the clinical symptoms of undernutrition or the protein energy malnutrition, the marasmus and kwashiorkor. These are the two clinical symptoms associated with the undernutrition. Severe acute malnutrition is a separate entity used to denote acuteness and needed for emergency management and is used in the program settings. So the major clinical symptoms under the undernutrition, which are the marasmus and kwashiorkor. The marasmus, in the marasmus, the wasting is the hallmark of the marasmus, and child which appears very thin and wasting is visible in the arms, buttocks, and thighs. There will be loss of buccal pad or the fat, give rise to old man look or the monkey faces, and the child is alert but irritable, and there is no edema. So these are the salient features of the marasmus. In OPK, there will be a beautiful or a picture which showing the marasmic child. So there will be wasting that is very thin. The child is appears very thin. The wasting is the hallmark of the marasmus, and the child which appears very thin, and the wasting is visible in the arms, buttocks, and there will be loss of the buccal pad of the fat, and it looks like a old man look or the monkey faces, and the child is alert but irritable, and there is no edema. And the grades of wasting are the grade 1 is there will be loss of fat from the axle and groin, and grade 2 is there will be loss of fat from the thighs and buttock, and then there will be loss of fat from the chest and abdomen, and the grade 4 is buccal pad of fat. It is uh, remember by the A, B, C, D. That is A is axilla, B is buttocks, and C is chest, and D is buccal pad of fat. So that is A means axilla, and along with that we have to add groin, and then we have the buttocks. Along with that, adjacent structure is thighs. We have to add that. Then chest and abdomen. Then buccal pad of the fat. So these are the grades of wasting: A, B, C, D. Okay, then about the kwashiorkor, the essential features. The triad of the kwashiorkor is growth retardation, edema, and mental changes. That is apathy. Apathy, edema, and growth retardation, which are the triad of the kwashiorkor. These are usually asked as a 1 mark question. That is apathy, growth retardation, and edema, which are the features of kwashiorkor. But the wasting, the loss of the buccal pad of the fat, old man look of the monkey face, which are the features of the marasmus. Then about the grades of edema, first, if the edema which occurs in the pedal region, it is grade 1 kwashiorkor, and if there is facial edema, is the grade 2 kwashiorkor, paraspinal and chest edema is the that is grade 3, and if there is ascites, grade 4 kwashiorkor.